Everybody, Dr. Rob here, Facebook Live. We are going to talk about mechanical versus chemical stressors. It's something that's very unique and to chiropractic. So most people understand the basic premise of what we call a mechanical stressor. So a mechanical stressor is like a compression, like compressing a disc. A mechanical stressor is something like the pulling on a joint, pulling on a ligament, pulling on a tendon, something that you would see in an initial trauma, if you will. There's also something that occurs in the body called cumulative trauma disorder. Cumulative trauma disorder is like a carpal tunnel. Constant bending is a mechanical stressor. Movement leads to mechanical stressors. Trauma leads to mechanical stressors. The bulk of people complain about mechanical stressors. Overhead lifting is a mechanical stress. Are we okay? It's these.
I'm getting a phone call.
Oh, okay. It's these things that I'm getting a phone. I'm popular. It's these things that stress structures like tendons, ligaments, cartilage, and really damage what we call fascia that lead us down the path of mechanical stressors. So that's what you usually seek out chiropractic for, physical therapy, manual therapists, and the like. So people understand that, but a major component leading to mechanical stressors, or major component why mechanical stressors, these rotator cuff, these disc injuries, these ankle sprains, and the like do not heal, is not enough people are taking and adhering to concepts that enable you to address the chemical stressors. So chemical stressors do lead to mechanical stressors. Let's start with that. Number one, a great idea of a chemical stressor is just bending too much, bending at your spine, causing a mechanical stress at the collagen fibers, releasing chemicals like cytokines and MMPs. Cytokines are inflammatory markers that release something called interleukins. These interleukins stimulate NF-kappa B and can damage structures like a disc or a rotator cuff. In addition, they release in abundance MMPSs, matrix metalloproteinases, your body's own proteolytic enzymes, which eat fibrocartilage. Fibrocartilage is something that disc and some structures in the rotator cuff are made out of. So mechanical stressors lead to chemical stressors. If you don't address the chemical stressors, the mechanical stressors won't heal. How many times have you heard somebody speak to you and say, it doesn't go away, I have a chronic shoulder injury, I have a chronic back injury? They're not addressing that chemical component. Other chemical components that lead to the path, here's a great idea, is your gut. Your gut not being in perfect, pristine condition leads to these chemical stressors. The inability to modulate inflammation and inflammatory pathways is a chemical stressor. Omega-6 versus omega-3, a great example. Too much arachidonic acid, too many grains, too many safflower, too much sunflower, too much vegetable oil, no such thing. Not enough omega-3s. Not enough flaxseed, not enough EPA, DHA, not enough grass-fed beef will unlevel your ability to have too much inflammation chemically. So I can't fix anything when people have too much inflammation from chemical pathways. Other things, environmental toxins lead you to chemical pathways, lead you to damage mechanically, structural damage. Environmental toxins, now we just read, I just posted on Facebook, flossing your teeth, the chemicals in the teeth right in your mouth lead you down a path of taking in toxins. Too much touching the paper, the money, all these things are BPAs. They're environmental toxins. Walking outside, air pollution. In your own home, not sleeping on a mattress that doesn't have flame retardants. Another thing leading you down the path of having chemical stimulants. Other chemical stimulants, things you put in your mouth, gluten, sugar, dairy, lectins, if you're allergic to. All these things lead down a path of releasing chemicals that damage structures. So you come into the chiropractor, say you come into me, if I just adjust you, big thumbs up, soft tissue. So let's go through this. Say, hey, how many of you out there have lower back pain? Let me know. How many of you there have rotator cuff pain? How many of you out there have some sort of neck or headache? Probably right now, whoever's watching, or will they watch it a little later on Memorex, are going to raise their hand. You've had one or three or all of those. if you did, you come into my office, the first thing I would do to match the mechanical and chemical stressors is, number one, I would assess you. I may look at blood work. I'm going to look at movement. I want to see how you move. I want to see how you walk. I want to see how you squat. I want to see how you sit at the computer. I see how you do everyday movements to see if there's any break in movement which will lead to mechanical and chemical stressors. I'll probably adjust you. I'll do soft tissue like an active release. Instrument assisted like a factor. Something very new to the office that we just started. Cupping, but not cupping with bruising. Cupping where we're going to run over the body, where we're going to stimulate fascial fibroblastic proliferation. Tape, exercise rehab. Low-level laser, one of the great choices to enable mechanical stressors to heal and modulate chemical stressors. Low-level laser, use it all the time. FDA clearances on those. In addition, chemical stressors, blood tests. With all that, what else would I use chemically? I'm going to change your lifestyle. I'm going to ask you to, again, move better, start to exercise, take some inflammatory markers out, start using some basic nutritional supplements like fish oil, vitamin D, a good quality probiotic, a multivitamin, multimineral, increase your water. What you're looking for is someone who understands that the chemical and mechanical stresses are the way for you to have better overall musculoskeletal health. The reason that I went into chiropractic was I had a musculoskeletal problem, and I was helped by somebody very locally. That doctor is now one of my patients, and he was a mentor for many, many years. He helped me with a problem at 21 years old, and I went on this path to help everybody with musculoskeletal conditions also. And now the field has evolved to a point where we can start looking at these different mechanical and chemical stressors and really get to a point where we can help you with a musculoskeletal injury. So if you have a musculoskeletal injury, give me a call, feel free. I'll give you a free consultation. If you want, you can also just like, click, share, comment, tell me what you got. We'll have a conversation. Do we have any questions? No questions. We're real quiet. I'm sorry I'm a little late today. I got stuck with something. I know it's after 3 o'clock. Facebook Live, always. Please like, click, and share. Dr. Rob, always yours in health.